I wanted to say something about health in broader terms, and I think it's fair to say that my own views of healthcare underwent a profound change when I spent something like 6 years of inordinate and traumatic intensity dealing with the HIV/AIDS crisis in Africa. I had the enormous privilege of being the UN Special Envoy on HIV/AIDS in Africa from 2001 till 2007, and have spent the last several years focused on that issue. And when you visit a continent which was in the throes of death, where every country felt like a graveyard, and you visit it repetitively, and you spend up to 6 years literally watching people die, an approximation of the Ebola crisis, if I can make that juxtaposition for you, then you begin to appreciate profoundly those who are attempting to overcome the apocalypse. And right at the heart of it were the medical practitioners. They were always few in number, and a large number of doctors died in the course of the AIDS pandemic. But those that remained in the hospitals and the health clinics were performing miraculous interventions and holding societies together. And they did it with a selflessness and a commitment, I guess, which human beings always respond to when they're under attack. We've just seen a parallel incident in Europe. The sense of the adversity to which humankind is so often subject brings out the best in people in response. And I can't tell you how magnificently the medical profession performed in a leadership role, because everybody turned to the doctors to distribute and provide antiretroviral therapy and to initiate the prevention and the care and the treatment literacy which was necessary in order for populations to survive. And when you look at the work of an outfit like MSF, like Médecins Sans Frontières, and others, one understands why doctors are so appreciated and so valued at times of stress. So too the nurses. I mean, the nurses were absolutely magnificent. I've often thought in my own somewhat quixotic life that nurses and teachers are the centerpiece of society. I can remember being in the university teaching hospital in Lusaka, the capital of Zambia, going through the male ward with 73 beds late one night. Every single occupant of that ward would be in intensive care in a Chicago hospital. And on an entire 12-hour shift, from 8 p.m. to 8 a.m., there was one nurse. And it was a staggering commentary on the way in which human beings respond to that kind of critical moment. And I fell in love with the nursing profession as I watched how stoically and courageously they intervened. And the need to construct a team in those situations so that everyone is playing an indispensable role, because you've got to do the counseling and the caregiving as well as the interventions and the medicine and the medical involvement of the doctors. Everybody has to work in a team, and it kind of came together spontaneously under the auspices of the doctor overseeing it. The experience that I remember most, and it didn't deal with HIV, ironically, occurred not long ago when I visited the Democratic Republic of the Congo. I've been a number of times, gone from time to time with Eve Ensler, the magnificent writer of the Vagina Dialogue, the Vagina book that Eve has done and is performed. The Vagina monologues are performed all over the world. And she built something called the City of Joy, which is adjacent to something called the Pansy Hospital. The Pansy Hospital is in the little regional capital of Bukavu in South Kivu in the eastern region of the Congo, where, as you will know, marauding militia groups have engaged in unbridled sexual violence of a kind that is approximated only by ISIS at this moment. At least 500,000 women raped over the last 10 to 15 years in the most brutal and nightmarish fashion. And right at the heart of Bukavu is the little Pansy Hospital, cheek by jowl with the City of Joy, where women recuperate. And if you stand at the door of the hospital for any length of time, as I have done on a number of occasions, the women are transported to the hospital by family and friends after they've been subject to the most horrendous sexual abuse. And the surgeon who oversees the hospital, Dr. Denis Mukwege, who just won the Sakharov Prize for Human Rights in Europe, Dr. Mukwege and his colleague surgeons spend much of their time surgically repairing the reproductive tracts of the women. And it's an astonishing example of commitment and the refusal to allow lives to be completely destroyed by the lunacy of the military that wanders through the landscape of the Congo. And Denis works with a handful of doctors, a handful of nurses, a handful of counselors, and they do it in a team. They never overlap. They know that they're fighting for survival for everyone, every woman who comes in. And Denis manages to draw from them the strength and commitment which good leadership draws. Because it's not self-aggrandizing, it's not self-important, it's not self-infatuated. It's inclusive and engaged and sensitive. And it's a wondrous thing to observe in the midst of that horror story. And I've often thought that that's the essence of leadership, to engage and yet not to dominate. And that's exactly what happens in the case of the Congo, in the Pansy Hospital, and it is an astonishing reflection of how things can occasionally work. And what one learns over time is that even though everything is hierarchical in the United Nations, whether it's an agency like UNICEF or a secretariat headed by Ban Ki-moon, it's the people in the field who do the work. And if you get a decent representative of an individual agency, whether it's UNICEF or UNDP or WHO or UN Women or the UN Fund for Population Activities, if you get a decent representative, then again, they create teams. As I traveled around from country to country, I would sit down and meet with the UN team, representatives from all of the agencies who were designated in that country. And we would sort through the response to the pandemic. And it was the teamwork that did it. So I know that I'm simply emphasizing that with which you are all consumed, but I must say that the ability to understand leadership as teamwork is the preeminent function. The discussions that are taking place here now, and the discussions about the American healthcare system, which are all-consuming and being watched by all the rest of us who look upon them with a kind of mystification, but the sorts of things you're dealing with now are a reflection of the world's obsession with health. It's really quite fascinating. Health is now at the center of everything the world is engaged in. The United Nations, in the last 2 months, has spent almost all its time hammering out what are called the Sustainable Development Goals. And those are the goals internationally which will govern public policy for the next 15 years. In the year 2000, they hammered out the Millennium Development Goals, 8 goals to be achieved by the year 2015. They weren't achieved by the year 2015, so now we have 17 goals have emerged for the United Nations with something like 180 targets. But even though it's possible to be quite cynical and skeptical about these broad objectives which are set by multilateral institutions, the fact is, and it's fascinating, that increasingly they are the benchmarks of public policy in country after country. And it's interesting that as the UN looks at these Sustainable Development Goals, it has said to all of the agencies, health, that's the centerpiece. As a matter of fact, they've done some for the UN quite remarkable things. In the Millennium Development Goals, there was absolutely no reference whatsoever to sexual and reproductive health. Not a word. In the Sustainable Development Goals that have just emerged, there's a whole separate focus on sexual and reproductive health. And for the first time, and this is, I think, an honorable moment in the history of the United States dealing with international agency, the United States has accepted the phrase sexual and reproductive rights rather than simply health. So these questions of health and human rights are coming together. And I make that point because leadership also consists of taking strong stands on issues which occur outside the hospital or health clinic or regional health center establishment, but are the essence of a decent society. So, for example, and I obviously I'm a Canadian, I can say these things more comfortably, and then I can race off to the plane confident that you'll never catch up with me. What is being done to Planned Parenthood in this country is an obscenity. It's outrageous. It would never happen in Canada. I can say that absolutely in an unqualified way. And it's so important that the woman's right to choose and to deal with sexual and reproductive health without being scapegoated and without being compromised and without being denied services because of some ideological fetish. It's important that people in the health system speak out on these issues. It's terribly important in terms of leadership that voices are heard, and no voice is stronger and more informed than the CEOs of major health establishments. And if CEOs take public positions rather than surrendering them largely to political interests, it can make a huge difference, and in this case, a huge difference in the lives of women. That would give a real definition to the exercise of leadership. And I'm not talking about clinical or administrative matters, but I think matters that are just as important. The first is, of course, the social determinants of health. The patients who come to you, those who present themselves, are often assailed by circumstance, by their environment, by the society as a whole. So every bit as important as clinical intervention, every bit as important as any drug that emerges, is the question of poverty, is the question of homelessness, is the question of employment, of childcare. The whole panorama of public health is informed and driven by the circumstances in society. I couldn't help but notice as we were driving in from the airport, I couldn't help but notice because we were inching along, and it was possible to look at every billboard as we inched. I couldn't help but notice the signs about the food banks, and 1 out of every 6 Chicagoans having to turn to a food bank during the course of the year. And I thought to myself, as I have thought in my own country, how in God's name is this possible? How is it possible to have the most civilized and privileged societies in the world with 15 to 20% of the population living below the poverty line? What kind of atrocity is that? What kind of excrescence is that in a society which pretends to value human priorities? And I have to say that, again, those who are in the field of health, who service people who emerge with problems because of the circumstances in their lives to which they're subjected, that has to be talked about and discussed. Lives are at stake. It's a question of valuing each individual human being and realizing the extent of the vulnerability and understanding that people who are impoverished and homeless and don't have childcare arrangements and don't have employment, this is what has them ending up in your hands. momentum is moving to public health and away from criminalization, as more and more people understand that the war on drugs is simply not tenable. It has caused far greater pain than it has provided benefit. And now you have major commissions on drugs chaired by a former president of Brazil, with people like Kofi Annan, the former Secretary General of the United Nations. Now, the second thing is the matter of diversity. And again, that's absolutely crucial. And it's easy to say the word, we all say the word, but in order to have a hospital or a health center, a regional health center, function adequately, it must have representation, certainly at least by way of outreach, but preferably in all of the committees and in the administrative fulcrum of the organization, whether it's from LGBT groups or ethnicity or indigenous peoples. There are a lot of First Nations in the United States who desperately need access to health care, or refugees, or those who emerge from gender-based violence. All of this should be part of a health apparatus which values diversity and doesn't just use the word in a facile and flippant fashion. Quote, "Despite considerable attention to this topic over the past decade, frustrating little progress has been made nationally in senior leadership teams becoming more culturally and gender diverse." Now, this is 2014. Those are your words, the words of NCHL, and I quote them because they're accurate. They're always accurate, because it's so easy to litter the landscape of figurative language with references to diversity without ever really incorporating it. Of the things that have to be emphasized in order to prepare people for leadership, and nowhere in all of these subjects, a larger talent pool, better relations with and among physicians, enhanced physician recruitment, increased staff engagement and retention, enhanced productivity, higher quality, better coordinated care increase, just goes on and on and on, and not a reference to diversity. Not a reference to cultural and ethnic priorities, not a reference to gender. It's interesting. You see that despite the emphasis on leadership and teams and team building and running a facility with grace and integrity, it's so tough to put diversity in place. You have to sit down and do it at all costs, because nothing gives an institution, a health center, more reputation than true diversity. And the third thing I want to mention is community. And again, I was fascinated to read your own material, because it's really important. You have a session tomorrow morning on Healthy Community Alliance, launching community partnerships to serve the community. Launching community partnerships to serve the community. And in the best practices in healthcare organizations, you have this quote: "Equip current and future physician leaders with the skills, experiences, insights, and connections required to effectively manage and lead to achieve the organization's strategic vision in a challenging healthcare environment and advance the health of their communities." So your own monographs are saying unequivocally that the role of the physician leader, the role of the administrative senior management, is to go outside the facility and to reach the community, bring it into the facility, give the community full capacity and authorship of so much of what you do, and take the health system into the community and make pronouncements and take stands. All of our countries desperately need people who will take stands. This is obviously a digression, but it's kind of interesting. African grandmothers are sustaining whole countries because they've lost that intermediate generation. So the African grandmothers are bringing up their orphan grandchildren, having buried their own sons and daughters. And they do it with magnificent elan and commitment, and they're very smart, and they have tremendous generosity of spirit, and they have a selflessness which is supernatural. And these 500 grandmothers gathered together from 6 different projects in Uganda, which we happen to support, were extraordinary. And you could see as they divided themselves up into 5 or 6 working groups after every plenary session, that the natural leaders of the group built a kind of rapport, a kind of solidarity within the group, which was tremendously engaging. And I watched this process for 2.5 days because the spirit of our foundation is that we don't try to direct. We're just there to try to assist. And we step back from these things. And I watched it for a couple of days, and I thought, you know, the instinctive leadership, the natural leadership that flows from the community, understanding how powerful the grassroots really is, how valuable the community is. It's just fascinating to see it at work, and it's so often undervalued. And the last area that I want to raise, which is for me the single most important area that I ever am engaged with, is the question of women. I married a feminist. I live in a feminist family. I love it. I have a wife who for 25 years was the leading feminist voice in print in Canada. Her name is Michelle Landsberg, and she wrote columns which were gifted of prose, unrelenting, uncompromising, principled, tough, always feminist, a view of most issues. I've had the extraordinary privilege in 53 years of marriage to be able to phone home at any hour of the night or day and say, honey, what do I believe about so-and-so? And I'm always told in no uncertain terms, and then I can come to conferences like this and disgorge views that you mistakenly think are my own. And I want to say to you, from my viscera, from my soul, from my heart, that the single most important struggle on the planet is the struggle for gender equality. There is nothing that approximates it. And you can't continue to marginalize 50% of the world's population and ever expect to approximate equity or social justice. It's just not going to happen. And it's so important to understand that on every facet, every front of gender, women have to be at the center. And I notice in your literature that you acknowledge that a very small percentage of CEOs and a small percentage of people in the senior administrative cadre are women, and how that has to be improved. And in fact, there was a study done which said critical career inflection points for women healthcare executives. I noticed there were 3 men and 2 women who did this study. It is ever thus. In the UN, the Secretary General appoints a committee to look at overall peacekeeping operations, which is the largest operation of the United Nations, and the people who are most effective are the women on the ground who are to be protected. And he appoints a committee to look at it with 11 men and 3 women. We went after him, no holds barred. He had to apologize publicly. He doubled the number of women. He thought somehow that was parity. He's limited, very limited in his understanding of mathematics. But it was important to back him down. You see, it's Pavlovian. Forgive me, it isn't an inflection point. I mean, that's a fascinating academic exercise. And you look at what's happened en route when people have graduated, what they've done in postgraduate years, what they've risen to, what the mentorship has been, what support they've had from leaders. And those are inflection points, and they're fascinating to note in a documented way. But we're dealing with inescapable misogyny. We're dealing with the reality that it's just very difficult for men in a society to relinquish power. Personally, I think men as a species are largely beyond redemption. That's just a personal view. I don't imagine it's widely shared. But I really believe that it's not so much looking at inflection points and where things have gone right or wrong. It's recognizing the tremendous resistance everywhere to women occupying equal and senior positions in every facet of society. It's an endless struggle. And one can never pretend that sort of working away at it will resolve it. It won't resolve it. You just have to do it. There are a vast reservoir of talented women everywhere, and everyone in this room knows it, and there is no reason in the world why they shouldn't be CEOs of the organizations with which you're affiliated, rather than waiting 20 years to prove themselves, or waiting until the leadership or mentorship has managed to permit it. I genuinely feel that what society so often lacks, and what civil society can bring, is the voices of people with authority. And taking stands on issues, whether it's reproductive health on one hand or the role of women on the other. This is important for the healthcare system because everybody is preoccupied with health as populations age, as communicable and non-communicable diseases harass the world, as climate change will create hundreds of millions of environmental refugees by the middle of this century, many of whom, over and above the Syrian refugees, will be coming to the shores of North America. All of these things posing problems of human health. And you bring to it a dignity, an integrity, a selflessness, a commitment, which is profound. And I salute you for it. And I hope you treasure it. And I hope you exercise it with as much vigor and urgency as you can summon.